Are You Bereaved? By Trisha Paul, MD, MFA. I signed up to volunteer at a writing workshop for bereaved parents of children who died of cancer. I thought I would be setting out notebooks, grabbing tissue boxes, and ushering in attendees. As a pediatric oncology fellow and a palliative care physician, I care for many children and young adults approaching the end of their life. Months after several of my patients died, I wanted to do something to support parents after their child's death, to learn about their grief. We gathered in a conference room that was too large for our small group. The facilitator, a grieving father and author, prompted attendees to write a letter to their child who died. When I asked him how I could help during the exercise, he encouraged me to write too, if I wanted. So I wrote to the 5-year-old and the 21-year-old that I had cared for as an oncologist. We ended with writing an email to share our grief needs with someone. I didn't know whom to address. More importantly, I wasn't sure if I had any needs. After the session, I told the facilitator about what I do and found myself asking if he would sign his book for me about writing through loss. He looked down at me, peering over his thin frame glasses. Are you bereaved? I noticed the brown of his eyes, a warm chestnut. No. At the time, it felt like the truth, or at least the truest thing to say. I didn't realize until after I spoke that something about the question puzzled me. He registered my response. We stood in silence until he clicked his pen and closed the cover. I walked the underground parking garage, his book in my hands and his question in my head. As I drove, his curiosity struck me. He made no assumptions about why I had volunteered. Maybe he understood that being a physician didn't mean that I couldn't also be a parent who lost a child or a sister who lost a sibling. At home, I placed the book on a shelf, but something about my response wasn't sitting right with me. I pulled the book out and opened the cover. Thank you for your work, it said. My work. As a clinician, was I bereaved? I closed the book and put the question back on the shelf. I was standing under a hot shower one evening, weeks later, when the question snuck up on me. I wrote, Are you bereaved? With my finger on the glass door. I do this sometimes, write words that are on my mind. I could see with clarity through the letters and into the bathroom mirror, the rest of the glass door opaque from the steam. Saying no felt wrong. To say no felt like I had denied losing so many young patients over the years. To claim that I was not bereaved felt like minimizing their impact on me, like I had denied how much I cared about them. My instinct to say no abashed me. My answer was not all that bothered me. It was how definitive I was in that moment, without pause or hesitation. The clinician in me thought I knew no to be the right answer to the question. My relationship to these patients and the loss that I felt when they died couldn't compare with what bereaved parents, siblings, and families experience, and it shouldn't. It was the best answer I could give, but it sat in me and unsettled me like a lie. As clinicians, we recognize grief in our patients and their families, but our abilities range when it comes to recognizing it in ourselves. My colleagues and I speak of our grief and feel ourselves grieving to varying degrees, but I had never heard any of us call ourselves bereaved. I wondered how radical it would have been if I had said yes. To be a bereaved clinician would be to claim loss as mine in its own way. It would mean keeping empty the jagged-edged gap left by patients whose deaths tore into me. I opened my eyes, feeling my own resistance to the thought. I didn't think my experience as a clinician should share the same modifier as families. I entered my patients' lives because of their cancer. I consented to the possibility and probability of loss. Something didn't feel right about repurposing a word that characterized the loss of family and friends when my own felt slanted. I didn't know I had grief needs because I had never recognized myself as bereaved. But would identifying as bereaved clinicians give us permission to grieve our patients? Not only acutely, but also indefinitely, to feel the reverberations of cumulative grief in our lives over time? Not everyone would consider themselves to be bereaved, but we know which deaths fissure us. Our lives include theirs. Our loss and pain differ, but it is there. Maybe, I wrote on the glass door. The shower had been running long enough that it was beginning to cool. At one point, my body couldn't have stood under water so warm. I imagine my nerve endings now, years into this, desensitized to the high temperatures, acquainted to a sensation that was once more painful. I still registered the heat. Pain was still there, but it had dulled. Somehow, instead of withdrawing reflexively from the hot water, I'd managed to stay standing in it. I shut the water off and felt the steam slowing, the air thinning around me. I watched the words on the glass disappearing. The question first, and then the answer.
Welcome back to JCO's Cancer Stories, the Art of Oncology. This ASCO podcast features intimate narratives and perspectives from authors exploring their experience in oncology. I'm your host, Mikkael Sekeres. I'm professor of medicine and chief of the Division of Hematology at the Sylvester Comprehensive Cancer Center, University of Miami. Joining us today is Trisha Paul, an assistant professor in Pediatric Hematology, Oncology and Palliative Care at University of Rochester Medical Center, to discuss her Journal of Clinical Oncology article, Are You Bereaved? At the time of this recording, our guest has no disclosures. Trisha, thank you so much for contributing this terrific essay to the Journal of Clinical Oncology and for joining us to discuss your article.
Thank you so much for having me today, Dr. Sekeres.
So we agreed for everyone listening to call each other by first names, and then Dr. Paul just called me Dr. Sekeres.
Still adjusting to being an attending.
That is fantastic.
Thank you so much for having me, Mikkael.
That was great. Well, you already gave us a little bit of a hint. Can we start off by my asking you if you can tell us about yourself, where are you from, and walk us through your career thus far?
Sure. I'm originally from Ann Arbor, Michigan, born and raised there, and I completed my undergraduate medical school education at the University of Michigan. I proceeded to do a general pediatrics residency at the University of Minnesota, and then went to St. Jude Children's Research Hospital for a combined fellowship in pediatric hematology, oncology, and hospice and palliative medicine. What brought me into this area of medicine was early experiences as a high school student volunteering at a children's hospital in my hometown. And that's where I found myself in a playroom, spending time with children with cancer and their families. And these experiences of being with patients and families and getting to know them outside of their illnesses was really what brought me to wanting to be not only a pediatric oncologist, but also a palliative care physician who could care for patients holistically.
Wow. So you were introduced to this field at a preternaturally young age.
Yes, it's been more than a decade that I've been aspiring to be a pediatric oncologist and a palliative care physician, and I feel fortunate to be there now.
That's fantastic. And I should say, given your University of Michigan pedigree, go blue.
Thank you. Go Blue.
Although, at the time of this recording, Miami is undefeated in football. So, go us. In your essay, I really love how you draw us as readers into your story. You signed up to volunteer at a writing workshop for bereaved parents of children who died from cancer. Can you set the scene for us? Where did this take place? How many people attended? And why did you sign up for the workshop in the first place? I can imagine this would be an incredibly moving experience.
Yes, Day of Remembrance is an annual event hosted at St. Jude Children's Research Hospital. Many hospitals have similar events where we honor patients who have passed away and we invite their families back to campus to honor these patients. And I started my fellowship in 2021, and so we were still coming out of the pandemic. This workshop that I attended was the first time that I was having an opportunity to attend the annual Day of Remembrance. And at the time, I had completed my palliative care training and I was wrapping up my pediatric oncology fellowship. The annual Day of Remembrance this year was hosted at a convention center on the banks of the Mississippi River, nearby and next to St. Jude Children's Research Hospital. And it was a large convention center that kind of spans the horizon. And it's one of those spaces where you go for medical conferences typically. And it was interesting to walk into this convention center space and all these conference rooms and instead see poster boards that are sharing the stories and the lives of all these children and adolescents who had died over the past several years. One reason I think the timing of this event occurred for me was that I realized that I also knew several patients and families who might be in attendance at this event. I was several years into my fellowship at the time. And so I think the other reason I chose to volunteer at this event was I had spent a lot of time with patients and families whose child was approaching the end of their life. And I had kind of gotten to be with parents and siblings in that period of time. But what often happens for me as a palliative care physician and as an oncologist is the relationship is different after the child dies. And so for many of the patients I cared for as a palliative care physician or as an oncologist, I wouldn't necessarily see these parents after the death of a child. There are some times where I've been able to see them at a memorial service, but otherwise we spend all this time with families leading up to a child's death. And often there's kind of this black box around them and their lives afterwards. And so I found myself really wanting to better understand the experiences of families after a child's death, which is what led me to participate and volunteer in the annual Day of Remembrance event. I didn't want to just attend. I wanted to be able to do something concrete and actionable with these families to learn more about their grief. And for me as a writer, volunteering at the writing workshop with bereaved parents seemed like a perfect way for me to be able to spend time with them.
Many of us as oncologists place boundaries between our interactions with patients, confining them to the workplace, but many don't. That you attended this workshop tells me that you may fall into the latter category. Was this a deliberate decision or something that evolved over time? And do you ever worry that erosion of such boundaries could contribute to burnout, or is it actually the opposite, that it reminds us of why we do what we do?
Yeah, I think this is a great question that I have been asking myself for years and that I anticipate spending the rest of my career wondering about and rediscovering for myself each time I have a patient and a family before me, that I'm exploring what I want those boundaries to look like or what I want those relationships to look like. I think that for me, my thinking about this has evolved even throughout the course of my training. I think I've better understood that these are decisions that are made on a very personal level, as well as decisions that have to be reassessed with each patient and with each family that we get to care for during this time. And so I think I'm always asking myself about, beyond being an oncologist and beyond being a person's palliative care physician, how do I want to care for them as another person?
Really nicely said. Did you recognize any of the parents at the writing workshop you attended or at the larger conference when you were there?
I did.
And what was that like, seeing them out of context?
In this specific situation, I think it was a little bit jarring in the sense that it was kind of the surprise that, especially these are patients I'd cared for in the past several years. And so there was a little bit of a moment to recognize and place them in where we had seen each other before. And then there was this fleeting wonder about whether they also recognized me. Some of these are patients that I might have met while on service as a palliative care physician for a brief visit or an initial consultation. And so for some of those families that I knew, there was less longevity to the ways in which I had known them. And it was curious to wonder if they remembered me and then to wonder about that memory.
Did any of them come up to you and say, "Oh, Dr. Paul, it's good to see you again," or "Do you remember me?"
No, I did not have that happen.
I think jarring is a really interesting word to use. A lot of our interactions are so contextual, and I find it difficult when I run into a patient or a family member and I'm outside of work and have to remind myself of not so much who they are, but where they are in their treatment course. And sometimes you forget because it's out of the context of our clinic rooms.
I think that's exactly right.
The author and grieving father who led the workshop in your essay writes in your copy of his book that he thanks you for your work. The way you describe that and isolate that phrase in your essay is, to the reader, I'll use your word again, jarring. Why was that so jarring to you?
It definitely felt jarring when I read those words in my book. There's something about the word work and kind of the connotations of work that separate it from a humanity of caring. It feels a little bit like an obligation or a task or a livelihood.
You think of what we do as a calling?
I don't think the phrase of it being a calling resonates with me personally that much, but it is more than just a thing I do. I think that's the problem with work. I think it's undermining why a lot of us choose to do this, which I think for many people, kind of this idea of a calling is how they think of it. I think the calling implies there's a lot more choice than I actually feel. Ever since some of the first patients and families that I met within this space, I understood that these are the people I wanted to spend the rest of my life caring for. And I guess that kind of sounds like a calling, but
I wasn't going to say it, but it sounds like a calling. You know, that word, and I love how you reflect on semantics in this essay. The notion of a calling sounds so highfalutin and almost religious and as if we're being spoken to, but I don't know. I think you could define it as something that just feels right to you and something that you should be doing and that you fall into, and you don't have as much deliberate choice in going into this field, but everything just feels right about it.
I think that's exactly it. So I think it's just that you don't really question for people who choose to do this work and to be with these patients and families. A lot of us, from the time we arrive at the realization that this is what we want to do, we don't find ourselves really questioning it in a concrete sense because we understand it. It makes sense to us.
I think that's a great summary of that. It just makes sense to us.
I think it's a mysterious idea to so many other people who don't do this work. And that's part of why it's interesting to a lot of people who just respond and say, oh, I can't imagine how you do this.
Well, it just feels as if we're contributing something so substantive to humanity by focusing on hematology, oncology, and particularly palliative care. I don't know about you. I don't know if you have children. I have certainly tried to impart to my children to do something meaningful, to do something that makes other people's lives better with whatever career they choose, because it's so meaningful, not just to ourselves, but to other people.
Mm-hmm.
We're talking about semantics. In your essay, you reflect on the notion of bereavement. Should we, as medical caregivers, cop to being bereaved, or are we misappropriating a word that really wholly belongs to close family members and friends of a person with cancer?
Yes. And I think that this essay was me kind of struggling to wrap my mind around what this question means and kind of what my own reactions to this idea of what it would look like and feel like to call ourselves bereaved. And I don't have an answer to this question. I think it's a question that everyone in this work should consider and think about and what it means for them as an individual.
Are there patients you've lost whom you think about even 1, 2, 3 years later on a regular basis?
Yes, I would definitely say so. I'm early in my career, but I anticipate that that is kind of an essential way in which I do this work. It's part of my own practice, and it's dependent on each patient, but find ways that I keep their legacy alive in my life.
I've thought a lot about your essay since I first read it, and I think it's okay to say that we grieve the loss of our patients. I think that is a form of bereavement.
I think so too. I think that it was interesting to realize my own hesitation about specifically calling ourselves bereaved when we do, as clinicians, talk about grief and secondary grief, and something about using the language of grief and grieving feels more appropriate and within our purview as clinicians. But something about specifically identifying as bereaved felt like a different step.
It's closer, isn't it? I don't know. It feels like more of a personal relationship rather than a professional relationship to be bereaved.
And I think that that's simultaneously terrifying and empowering as a way of acknowledging what the loss of a patient can do to us, and also honoring the affection we have for people we care for.
I hope it's okay that we end on that phrase that you just said. It's both terrifying and empowering to admit to being bereaved and to feel that closeness to one of our patients. It has been such a pleasure to have Trisha Paul, who is an assistant professor in Pediatric Hematology, Oncology and Palliative Care at the University of Rochester Medical Center, to discuss her essay, Are You Bereaved? Trisha, thank you so much for submitting your article and for joining us today for this enlightening conversation.
Thank you so much.
If you've enjoyed this episode, consider sharing it with a friend or colleague or leave us a review. Your feedback and support helps us continue to have these important conversations. If you're looking for more episodes in context, follow our show on Apple, Spotify, or wherever you listen, and explore more from ASCO at asco.org/podcasts. Until next time, this has been Mikkael Sekeres for Cancer Stories.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.